We are delighted to give our third Pluribus Unum Prize Corporate Leadership Award to Kaiser Permanente Health System. It's one of the largest, it's one of the most innovative, I think it probably is the most innovative health system large health system when it comes to language and cultural competence and access.
Kaiser Permanente's history and approach to diversity and inclusion has really been since its inception, over 60 years ago. Founded on the West Coast with a very diverse workforce and very diverse patient mix. And so right from its foundation and trying to move a new model of care, an integrated model of care against the mainstream of fee-for-service medicine, Kaiser pioneered an integrated approach.
Today, there is a plethora of evidence that show language and cultural barriers can lead to problems such as delay or denial of services, issues with medication management, underutilization of preventative health care, or overutilization of unnecessary diagnostics and treatment. These types of problems, if not managed proactively and managed well, can be costly to the patient's health and costly to any organization and costly to the community.
Kaiser, which has over 9 million members in 9 states, including California, addresses the issue of language access by training, testing, and certifying its multilingual staff who serve as healthcare translators. It's developed a centralized national platform for translators, an online glossary of U.S. healthcare terminology, and it's adopted the very latest translation technologies.
A critical part of healthcare is communications. And as patients identified their needs in terms of language requirements, language preference, written documents, and the important role that communication plays in the doctor-patient relationship, it was obvious to us a long time ago that we had to pay attention to that and then gear up our capability and capacity to meet those needs and expectations. So the point I want to make with all of that is that the notion of addressing language, communication, adapting our models and service delivery approaches to the requirements and preferences of our patients is something that we have always embraced, and what we're doing now is learning more about how to do that effectively and efficiently. Our patients speak somewhere in the neighborhood of 150 different languages, but in each of our markets, that may be very different. So our market here in Washington, D.C. may have a very different demand for language preference and language translation and interpretation services than in a much more diverse area like California. So it's customized by market in terms of assessing the needs and then our capabilities. As it relates to our workforce, we have an overall and overarching approach to talent management, which is to give everybody the best opportunities to evolve and grow and develop their talent to their highest potential. When we understand the need for language services, we talk to folks about their interests, their desire to develop skills and capabilities in that arena. We also have policies and standards that drive this work because given HIPAA or privacy compliance challenges and requirements, we have to make sure that people understand the importance of privacy and that they're skilled at a certifiable level so that the translations are not only making sense to the patient in terms of language translation, but they also make sense in terms of the medical model and medical terminology.
Finally, and strikingly, it shares these materials and its curriculum with other healthcare systems, even its local competitors.
So our qualified bilingual staff certification program was designed and conceived to build up the capabilities of our internal workforce. But as word got out into broader communities that this program existed, we've trained as many people outside of Kaiser Permanente in various communities in our respective markets as we have within. And that is aligned also with our overall mission, which is not only improve the health status of Kaiser members, but also the communities in which we serve. So collaborating with community organizations, sharing best practices, learning from them in terms of what they know are critical levers to pull to get impact, to get compliance, to get successful outcomes. That's been a very rich source of collaboration for us and adoption of best practices.
The award could not be more timely. There are roughly 25 million limited English proficient persons living in the United States, and a quarter of the newly insured under the Affordable Care Act will be limited English proficient.
I think with healthcare reform, creating new access channels for a larger number of people who, based on the assessment of their needs, will bring greater demand for these type of skills and services. The challenge for us is, even though we've had a long head start and are committed to this work, is to continually look for building increased capability and capacity, but also innovation to find more efficient and more effective ways, more technology-enabled ways to provide better services to a broad number of people. So we understand there is a value-added component to being a very diverse workforce and organization and having the privilege of caring for very diverse populations. That's just very validating for us that we're on the right journey, we're having impact, and it's being noticed. And we hope that serves as a source of honor and pride for our workforce to do even better.